teach the young people why it was important to get vaccinated for hepatitis B. It worked really well. They would see this big, healthy liver, and they'd see this small, nodular, just kind of shrunken liver. It worked really well until one time a fifth grader said, "Doctor, I see one liver's worse than the other, but it sure looks like both of them died." So I gave him an extra assignment. And so the point being, though, if you don't get that transplant, you die. There are other conditions for which, if you don't get the transplant, you die. In 1984, Congress created the Organ Procurement and Transplantation Network, or OPTN, a unique public-private partnership supported by hundreds of dedicated volunteers and experts. Last year, doctors in the U.S. performed more than 48,000 transplants, the most in a single year. In 2023, Congress passed the Securing the U.S. Organ Procurement and Transplantation Network Act, removing barriers in how the OPTN is managed, giving the Health Resources and Services Administration, HRSA, clear authority to improve the organ transplantation system in the U.S. For nearly 4 decades, OPTN was managed and run in its entirety by one single government contractor. But by breaking up the OPTN monopoly contract, we opened the door for more competition, transparency, accountability, and better results for patients. And it shows what happens when Congress drops partisan jerseys and works together to deliver a pro-patient, pro-family agenda for the American people. But I would argue there's more for Congress to do. There are over 100,000 patients waiting for a life-saving organ. We've heard reports of patient safety and dignity compromised and gross mishandling of organs, undermining public trust in the OPTN. Importantly, 13 people die daily waiting for a transplant. This committee has jurisdiction over the OPTN, and with that jurisdiction comes the responsibility to make sure the system is working as intended. And is there a way to cut down on a 100,000-person backlog off the waiting list? We should improve transparency, protect patient safety, and restore trust. There are 100,000 Americans waiting for that medical miracle called transplantation. We cannot fail them. President Trump's administration is making this a priority. We see this by them implementing tougher performance and accountability measures for organ procurement organizations, also called OPOs, and reduce financial barriers for living donors. I applaud the President's commitment to this issue and look forward to working closely with him on these efforts. I also appreciate Senator Grassley's long-standing leadership. Together, we've introduced the OPTN Fee Collection Authority Act to ensure responsible management of the fees that fund the OPTN. It increases transparency and encourages easy-to-implement common-sense improvements like automatic electronic referrals for donors. Senators Collins, Capito, Murray, and Baldwin, through their roles on the Appropriations Committee, have provided critical funding to modernize the OPTN. These efforts give Americans hope and a better chance that they will receive a life transplant. Again, pro-patient, pro-family, and making America healthy again. I look forward to today's discussion on how Congress can support the Trump administration, the OPTN, and the entire transplant community to better deliver for the American people. I will comment that obviously my ranking member was not here. And I think it's a shame he was unable to make time to attend today's hearing, considering approximately 13 people die on the transplant waiting list daily. It's also worth noting that the ranking member was given ample opportunity to engage on this hearing in a bipartisan fashion, but declined to do so. This is continuing a pattern of not working in good faith and prioritizing personal agenda over bipartisan discussions. But I will say, I am committed to working with every member of this committee to advance bipartisan solutions on issues as important as this. We've done so numerous times in the past and will continue to do so. With that,